Hello, Toastmasters and honored guests. It is true, I am no stranger to strange doctor appointments involving myself or my children when they were younger, so much so that I feel it would be selfish of me not to articulate a few of them for you. Again, I ask you for each vignette, true vignette, to ask yourself, what's wrong with this picture? The first doctor appointment was a visit to an ENT/otolaryngologist throat doctor in my late 20s. That summer, I had sung for a music festival in Brevard, North Carolina called Brevard Music Festival. It's basically an apprenticeship for aspiring singers, unpaid, I might add. Nevertheless, I had to learn a major operatic role in 3 days and then sing it. This caused some vocal damage. When I got home, I set up an appointment with an ENT. There I was sitting in the doctor's room waiting for him to come in. In strolls in this man dressed in a long white coat, very young, baby face. He looked like he had just maybe graduated from medical school, very confident. He's looking at his clipboard and he said, Ms. Thorson, that was my maiden name. What seems to be the problem? I said, I'm a singer and I sang for something last summer and I feel like I might have gotten a vocal no. I was about to say node. A node is a callus on the throat. And before I even got the word out of my mouth, I think I might have a vocal no. He said, well, did you know that I'm a singer as well, Ms. Thorson? And I said, really? And he said, yes, I actually was a vocal performance major for my undergrad at the College Kansas Conservatory of Music. And I just, okay. As a matter of fact, Ms. Thorson, I was in the men's chorus. I was the premier baritone soloist. We did an 8-week tour. I had more solos than anyone else. I also sang for, and at this point, I was just blocking it out. I was just in total shock. He was just going on and on and on. This probably lasted 5 to 10 minutes, which is a long time to talk about yourself when you're supposed to be focusing on the patient's problem. I was just amazed. Finally, I just thought, who is this guy? Who is he? I look up at his name tag. He had this little blue rectangular name tag. Guess what this braggadocio's name was? Take a guess. Anybody? Dr. Bragg. Good. Dr. Ham. Dr. Ham. I thought, how apropos. The second scenario was a pediatrician appointment for my then 3-year-old son, who's now 32 years old and expecting his first child with his wife. How time flies. I took him to the well checkup. This was routine. He was a healthy kid. Boring, routine. There we were in the room. The doctor, who was new to the practice, was examining him on the examining table, checking out his ears, lungs, his throat, his eyes, etc. So his back was to me as he's checking out my son, and I'm just standing in the back. He gets that speculum thing, he puts it in one ear, he looks at it, then he looks at the other ear, and then when he looked in the other ear, I heard this little noise emanate from his throat. I heard this little, and I remember thinking, what is that guinea pig sound? He whirls around in a complete agitated state and he said, your son has a severe ear infection. And I was just taken aback a little bit that the overreaction of him. And then, as if to indicate that he was angry that I didn't react, he said, his nostrils were flaring, I said he has a severe ear infection. His throat is completely red. It's completely inflamed. And then suddenly, out of nowhere, this role reversal occurred where I became sort of the person in charge. And I said, okay, then we'll get some antibiotics. He said, yes, we'll get some antibiotics. And he reaches in his pocket and he flips out this little, prescription thing. He said, I'll write a prescription for amoxicillin, 500 milligrams, extra strength. I said, okay. And I'm also going to write a prescription for eardrops 3 times a day. Now, he must lie completely still for 20 minutes after each eardrop. And I just thought, okay. Now, this doctor who acted as if an ear infection was the worst thing that you could diagnose a child with. What do you think his name was? Take a guess.
Tragedy.
Good. This melodramatic doctor who thrashed me for not reacting to an ear infection, his name was Dr. Corn, as in, corny. I thought, oh, so true to the name. I couldn't believe it. The third and final true story involved a phone conversation with the pediatrician on call when my aforementioned son was at that time just barely 10 months old. We were fortunate enough to have a pediatrician practice that had a doctor on call on the weekends. It seems like, as you know, children get sick on the weekends. It was a beautiful Saturday morning in early May. I got little Ryan up. I changed his diaper. He was smiling. He was just a very wonderful, wonderful little baby. When I changed his diaper, I noticed these bright pink, tiny round spots on his abdomen. I thought, that's very strange. I checked the rest of his body. No little pink spots. He was acting fine, no fever, just a normal routine day with this kid with these cute little pink spots staring up at me. I thought, okay, all right, I'll call the doctor on call. I know how this works. So I called the answering service and they said, yes, we'll have a member of the practice call you. Now, just as a little precursor, the doctor who called me, I am changing his name to Dr. Flobinson, rhymes with Robinson. Dr. Flobinson happened to be the doctor on call. In his defense, I must say that whenever my kids had an appointment with him in person, he was a very nice, very kind man. He loved his job, loved his kids. No question was ever too dumb for a young new mother to ask. He would pace and say, oh, that's a very good question, Mrs. Simmerlink. Oh, let me tell you, at 6 months, they typically, but if he was a doctor on call, God help you, it was a total Mr. Hyde, Dr. Jekyll transformation. He was very, very, very grouchy. Now, when your children are sick and you have a grouchy doctor on call, who cares? You just want to get the information you need. You need to know if you need to take them to the emergency room, whatever. I never cared about that in the past. Anyways, the phone rings and it was him. Hello, Mrs. Simmerlink. That's exactly that's the first thing he said. Mrs. Simmerlink, like, this better be good, Mrs. Simmerlink. And he said, well, what's the problem? And I said, well, my son woke up and he has these pink little spots on his abdomen. And I just thought I should call. And he said, well, does he have a fever? I said, no. Is he nauseous? No. Throwing up? No. Diarrhea? No. Is he acting in pain? Is he crying? No. And I said, no, he's perfectly fine. He just has these little pink spots on his abdomen. He said, does he have them anywhere else on his body? And I said, no. And he said, okay, well, then, what are they like? Are they raised? Are they rough and bumpy? Or are they smooth? And I just kind of felt his stomach. I said, sort of in between. And he said, well, then, how big are the spots, Mrs. Timberlake? And then all of a sudden it clicked for me. I thought, oh, yes, this is the doctor who's completely kind in person, but is a complete phantom of a vampire on the phone. And I remember thinking, I just made a very quick, spontaneous decision. I thought, okay, the more you rush me, the faster you talk, the slower I am going to talk. And I'm going to insert deliberate pauses. Now, this was years before I ever thought of joining Toastmasters. Perhaps it was a foretelling of my future calling as a Toastmaster. Anyways, he said, so how big are the spots, Mrs. Simmerlink? Are they about the size of a quarter? And I said, no. Well, are they about the size of a nickel? And I said, no. And he said, well, are they about the size of a dime? And I felt like saying, well, aren't you going to say a penny? Isn't a penny in between the size of a dime and a nickel? But I didn't. I said, no. And he said, okay, well then, just how big are the spots on your son's abdomen, Mrs. Timberlake? And this is when I truly was having fun. I said, oh, and they were, well, how big? Oh, about the size of a tip of an eraser. And he said, well, I can't diagnose over the phone. You're going to have to bring him in right away. Slam. I thought, okay, whatever. The question remains, what's wrong with this with these scenarios. But honestly, if you don't have a valid answer for that by now, I really don't have any more to say. Mrs. Toastmaster, fellow Toastmasters, and honored guests.